up guys, this is EG. Today we're going to be talking about SIADH, Syndrome Inappropriate Antidiuretic Hormone. Syndrome Inappropriate Antidiuretic Hormone is a condition that occurs when your body produces too much antidiuretic hormone, also known as ADH. Remember that ADH, also known as vasopressin, is responsible for retaining water in the body by instructing your kidneys to reabsorb more water. The most common cause of SIADH is cancer, especially small cell lung cancer. Other causes of SIADH are central nervous system problems like strokes and head traumas. Also, certain medications like carbamazepine and selective serotonin reactive inhibitor antidepressants are linked to causing SIADH. These drugs usually enhance the release of ADH in your body. Now let's talk about the clinical manifestations of SIADH. The initial symptoms of SIADH that you may notice are thirst and fatigue. Your patient may eventually gain weight and experience hypertension due to increased water retentions in their body. Once their serum sodium drops, you'll start seeing symptoms of hyponatremia like confusion, altered level of consciousness, and vomiting. They might have abdominal or muscle cramps. In worst case, seizures or coma also might occur. Also, since their kidneys are reabsorbing water, their urine output decreases. Now, let's talk about the diagnostic tests. When conducting diagnostic tests to rule out SIADH, you can check their urine specific gravity. This test reflects the concentration of particles in the urine. And remember that a patient with SIADH has decrease in urine output, which typically results in high urine specific gravity, indicating highly concentrated urine. Another test that we check is their serum sodium. Their serum sodium levels drop due to an excess of fluid in their blood, which dilutes the sodium. Their serum osmolality is low too, due to an excess of water in their blood, which dilutes the particles. Serum osmolality is basically the concentration of particles in the plasma or in your blood. Now, the treatment for SIADH is to find the cause and treat the cause. For nursing management, closely monitor your patient's vital signs and lab values, especially their serum sodium. Also, document their fluid intake and urine output. Since they're retaining fluid, you might want to limit their fluid intake, usually less than 1 liter per day. Frequently assess their neurological status and look for signs and symptoms of hyponatremia like confusion, altered level of consciousness, or even seizures. Safety is also a priority, so implement fall risks and seizure precautions. The preferred drugs for SIADH are democlocycline, tolvaptan, and conivaptan. These drugs block the effect and release of ADH in their body. By blocking ADH, you can expect their urine output to increase. One thing to note about tolvaptan and conivaptan is that they can cause hepatotoxicity, so monitor their liver function tests and avoid giving them to patients with liver problems. Okay? Increased urine output can result in severe hyponatremia, so if your patient has severe hyponatremia, we can administer a hypertonic solution like 3% sodium chloride. However, don't get too excited to increase that serum sodium quickly, as it can lead to osmotic demyelination syndrome. Osmotic demyelination syndrome occurs when fluid is removed from the brain cells too quickly, which can damage the myelin sheath. So make sure not to increase their serum sodium by more than 8 milliequivalent per liter per day. Another method to decrease ADH release without using any drugs is to position your patient's head flat or below 10 degrees. This enhances the venous return to the heart and minimizes the release of ADH in the body.